Have you been told there's nothing more you can do for your vision, even as your eyes feel drier, foggier, or more strained each month?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're examining dimethyl sulfoxide, or DMSO, and why many patients report that it restores comfort, clarity, and resilience to your eyes when conventional options fall short. I'm Ethan Foster, and my goal is to walk you through what makes DMSO different: its ability to reduce inflammation, improve circulation, carry other agents into tissue, and revive cells that are on the edge of failing. You'll also hear where clinicians and readers have seen the strongest results, from surface irritation to injuries and vision changes once considered irreversible.
I'm Alara Sky. DMSO has been described as an umbrella remedy because you see its effects across many systems, but it shows a unique affinity for your eyes. Early clinical trials repeatedly noted that when DMSO was used for unrelated problems, vision often improved. Many people still report clearer sight after applying it to nearby areas like the neck, likely because of the close blood supply.
Before we go further, history matters. When DMSO research surged in the 1960s, public demand was intense and pushback followed. Interest faded for decades. Recent years reopened the conversation, and thousands of reader reports now describe rapid healing of injuries and stubborn pain, with a surprising number centered on eyesight.
Safety is a common question. DMSO was scrutinized closely in ophthalmology, including reports in major journals attesting to eye safety. In one study where it was applied to the eyes of more than 100 patients, many already dealing with complex eye diseases, the only noted effect was a temporary, concentration-dependent irritation. That profile led clinicians to test it cautiously in a range of conditions.
Let's start with issues around your eyes that drive daily discomfort and strain. Because DMSO calms inflammation, relaxes muscles, and helps tissue retain moisture, it has been used for blepharitis, styes, and inflamed eyelids. Reports include reductions in swelling and pain, partial or complete responses in chronic lid conditions, and improvements in stubborn problems like recurrent styes and chemical or heat burns around the lids.
Muscle tension is another overlooked driver. Chronically tight ocular and facial muscles distort focus and exhaust your visual system. Clinicians and readers have described eye twitches easing and rare conditions marked by involuntary muscle activity settling after DMSO. When combined with vision exercises, some people say the benefits accelerate, suggesting that relaxation of overactive muscles removes a bottleneck to progress.
Move to the surface of the eye, your cornea and conjunctiva, and the pattern continues. DMSO tends to concentrate in the cornea, and as an acetylcholine esterase inhibitor, it stimulates parasympathetic activity, which increases tear secretion. Readers with severe dry eye, including those affected by Parkinson's, mast cell activation, or chemotherapy, have reported longer-lasting moisture, fewer infections, and sharper, less blurry vision.
Beyond dryness, corneal injuries and degenerative problems are where DMSO's tissue healing profile stands out. You'll find reports of long-standing corneal pain resolving, tear production returning on testing, and difficult cases like conjunctivitis or pterygium improving. Its ability to remove edema and pathological protein deposits makes it a candidate for rare challenges such as gelatinous drop-like corneal dystrophy, where case evidence shows amyloid clearing after treatment.
Corneal edema itself has been repeatedly observed to improve with DMSO. People with Fuchs dystrophy, where fluid accumulates in the cornea and vision slowly fades, have shared early experiences of reduced swelling and better clarity. While not every report ends the same way, the signal is consistent enough to keep interest high and encourages careful, documented trials.
Inflammation and infection on the eye's surface respond as well. In controlled settings, DMSO has shown anti-inflammatory effects comparable to low-dose steroid drops. For chronic superficial keratitis, combinations such as DMSO plus dexamethasone or prednisolone have produced stronger outcomes than either alone, improving transparency and reducing vascular overgrowth. Pairings with cyclosporin and other agents have shown similar advantages.
Because DMSO enhances penetration, it can potentiate certain ocular medications, including anesthetic drops and antivirals, offering a route to increase efficacy without injections. That carrier action explains why some ophthalmologists have experimented with topical nutraceutical combinations to address conditions long labeled incurable, from macular edema to traumatic uveitis.
Injuries are another clear use case. Experimental models show DMSO limiting the damage from alkali or acid burns to the cornea, reducing ulceration and opacity. Readers echo this with accounts of vision rapidly returning after blunt injuries and burst vessels settling within days when standard care stalled. The same pattern appears in veterinary reports. Ulcerated, hopeless eyes in pets recovering fully rather than being removed.
You'll also hear about DMSO cleaning out your eyes, sharper contrast, fewer floaters, less haze. A plausible explanation is that DMSO can refold or dissolve misfolded proteins and opaque aggregates within the cornea, lens, or vitreous, while supporting retinal function. Many people cite floater reduction first, then clearer lenses that align with cataract improvements, though experiences vary.
A practical thread runs through all of this. When inflammation quiets, edema drains, and protein debris clears, your eyes often feel immediately less strained. Tasks that once triggered fatigue, reading, screens, night driving, become manageable again. That day-to-day relief is why so many stick with carefully chosen approaches and share their outcomes.
At the same time, concentration matters. Studies reference a range of strengths, and irritation increases with higher percentages. Reports repeatedly emphasize patient-observed tolerance, incremental adjustments, and the value of pairing DMSO with compatible agents when a clinician deems it appropriate. The unifying point is simple. The compound is versatile, and precision improves results.
Step back, and the larger picture comes into focus. DMSO appears to bridge surface comfort, structural healing, and deeper functional gains. Documented uses include easing dryness, calming inflamed lids, supporting recovery from corneal trauma, and enhancing the impact of other topical therapies. Reported benefits stretch further into floaters, cataracts, and degenerative conditions once thought untouchable.
If you've been told your only path is to wait, inject, or accept decline, this evidence invites a second look. The renewed interest in DMSO has surfaced clinical observations, controlled trials, and thousands of lived experiences pointing in the same direction. Your eyes can respond when inflammation lifts, circulation improves, and damaged proteins are cleared.
Here's your challenge for today. Write down the top 2 eye symptoms that limit you. Then read the fuller DMSO article and case collections referenced by a Midwestern doctor. Note which surface or inflammatory patterns match your situation and what combinations were used. Bring that list to a qualified clinician and ask how you can safely test an approach that aligns with the evidence you've heard.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.